Welcome to the 10-Minute Medic. I'm your host, Dr. Bill Young. Today we're diving into a critical topic that you'll undoubtedly encounter in the field, and that is hemorrhagic shock. By the end of this podcast, you'll have an understanding of what hemorrhagic shock is, why it's so dangerous, and why rapid recognition and treatment are crucial. This knowledge will be fundamental to your ability to treat patients in emergency situations. Now, let's start with some clear definitions. Hemorrhagic shock is a life-threatening condition that occurs when the body loses so much blood that it can no longer provide adequate perfusion to tissues and organs. In simpler terms, that's what happens when severe bleeding causes your circulatory system to start failing. But let's break this down even further. Now, what do we mean by adequate perfusion? Perfusion refers to the delivery of oxygenated blood to the tissues at the capillary level. This process is crucial because it provides cells with oxygen and nutrients that they need to function and removes waste products. When perfusion is compromised, as in hemorrhagic shock, cells begin to die, leading to organ dysfunction and potentially organ failure. Now, why is hemorrhagic shock so critical? Well, to understand this, let's imagine your body as a finely tuned machine, a complex city with millions of inhabitants, if you will. Blood is like the supply trucks that keep every part of the city running. These trucks will deliver food, oxygen, and nutrients to the inhabitants, also known as cells, and remove garbage, waste products such as CO2 and various acids. When we lose a significant amount of blood, it's like suddenly reducing the number of supply trucks. Now, first, the city might manage. Some areas might get fewer deliveries, but most places are still going to get what they need. This is a compensatory phase of shock, where the body tries to maintain perfusion to vital organs. But if we don't replace those trucks and treat the blood loss quickly, eventually parts of the city will begin to shut down. Some neighborhoods, those of the non-vital organs, might be sacrificed to keep the essential services, such as we see in the brain, the heart, and the kidneys, running. If the situation continues, even these critical areas will begin to fail. In the human body, this shutting down translates to organ failure and ultimately death. This is why hemorrhagic shock is considered a true medical emergency. Every minute counts. The longer the body remains in a state of shock, the more damage occurs and the harder it becomes to reverse the process. So let's break down what happens during hemorrhagic shock in a little more detail. Well, first, blood loss occurs, reducing the volume in the circulatory system. Now, this can be as a result of external bleeding like a traumatic injury or internal bleeding, such as from a ruptured aneurysm, a GI bleed, or even esophageal varices. The reduction in blood volume leads to decreased venous return to the heart. Simply put, there's less blood coming back to the heart to be pumped out. That's your preload. Reduction in preload equals a reduction in cardiac output. The heart just can't pump what isn't there. Cardiac output is a function of heart rate and stroke volume, the amount of blood that is pumped out with each beat. Initially, the heart tries to compensate by beating faster and faster. Less blood flowing means less oxygen delivered to tissues and organs. This is compounded by the fact that in severe blood loss, we're also losing oxygen-carrying red blood cells. The body detects this decrease in blood pressure and oxygen delivery and initiates several compensatory mechanisms. The sympathetic nervous system is activated, causing an increase in the heart rate and contractility. Blood vessels constrict, particularly in non-vital areas like the skin and digestive tract, to maintain blood flow to vital organs. The body starts to shift fluid from the interstitial spaces into the bloodstream and tries to maintain volume. The respiratory rate increases to try to get more oxygen into the system. If bleeding continues, these compensatory mechanisms will eventually begin to fail. The heart rate can't keep up, especially with decreasing oxygen supply to the heart muscle itself. As compensation falls, blood pressure drops significantly. This is decompensated shock. Organs begin to shut down due to lack of oxygen and nutrients. The kidneys may stop producing urine, the brain function declines, leading to confusion and loss of consciousness, and the heart rate ultimately begins to fall. Without intervention, multi-organ failure occurs, leading to death. This progression can happen surprisingly fast, especially with rapid, severe blood loss. That's why your ability to recognize and respond quickly to hemorrhagic shock can mean the difference between life and death for your patients. Early recognition of shock is crucial for effective treatment. However, it's important to understand that the signs and symptoms of shock can be quite subtle in the early stages, especially in younger, healthier patients who can compensate well initially. Let's look at some of the signs and symptoms you might see as shock progresses. In early compensated shock, patient may be anxious or agitated. Their respiratory rate may go up. We may begin to see some pale, cool, clammy skin with an increase in the heart rate. Now, the blood pressure will generally still be normal or even slightly elevated due to the compensatory mechanisms. In progressive shock, it's also commonly called decompensated shock. Confusion or decreased level of consciousness begins to ensue, and our patient's blood pressure begins to drop, normally down below a 90 systolic. We begin to lose the peripheral pulses, and the extremities can become cold and mottled, and this is where the kidneys begin to shut down and decrease urine output. And then lastly, in late decompensated shock, it's also known as irreversible, our patient's unconscious. The blood pressure has dropped dramatically, or we can't even get one. We have extremely weak and slow carotid pulses. Our patient's breathing becomes agonal, and if we don't address this pretty quickly, cardiac arrest will ensue quickly. Now, keep in mind that all these signs might not be present, especially in the early stages. That's why it's crucial to take your time in the assessment of your patient and trend your vital signs. Don't get in a hurry when your patient looks and acts normal, especially in the presence of significant trauma. Any patient with potential for significant blood loss, whether from trauma, GI bleeding, ruptured ectopic pregnancy, or other causes, should be monitored closely for signs of shock. Now, there are a few special considerations to keep in mind when assessing for hemorrhagic shock. Older patients may have a blunted compensatory response. They might not show the typical tachycardia of early shock, and their blood pressure might drop earlier in the process. Highly conditioned individuals, such as athletes, might compensate better and for longer, potentially masking the early signs of shock. The physiological changes of pregnancy can mask shock. Pregnant women can lose up to 30 to 35% of their blood volume before they begin showing any signs of shock. Patients that are on beta blockers. These medications can prevent the tachycardia typically seen and needed in compensated shock. And then lastly, pediatric patients can compensate extremely well, maintaining a normal blood pressure until they crash. Keep in mind that very young pediatric patients can only compensate by increasing the heart rate. Their vascular has not developed well enough for it to be able to effectively constrict. Tachycardia and poor perfusion are often the earliest signs that we would see in these pediatric patients. Rapid recognition allows for immediate intervention, which is crucial in hemorrhagic shock. The longer a patient remains in shock, the more profound and potentially reversible the organ damage becomes. These steps should include, and not necessarily in this particular order, to control external bleeding with direct pressure, wound packing, a tourniquet as appropriate. Maintain the airway and support the breathing. Shock affects all the body systems, including respiratory. Be prepared to assist the ventilations if necessary. Initiating fluid resuscitation. Get a large bore IV access, and fluid administration is critical. However, the days of when we would just flood our patients with fluids are over. Current guidelines often recommend a more balanced approach, sometimes called permissive hypotension, especially in trauma patients. And keep in mind that your fluids do not carry oxygen. Rapid transport to an appropriate medical facility. Hemorrhagic shock patients often need surgical intervention to definitively control bleeding. Time is of the essence. In conclusion, hemorrhagic shock is a critical condition where severe blood loss leads to inadequate tissue perfusion, potentially resulting in organ failure and death. Its rapid progression makes quick recognition and treatment essential. As paramedics, your ability to spot the signs early, act decisively, and communicate effectively will be crucial in saving lives. Remember, in the face of hemorrhagic shock, you are the patient's best hope. Your knowledge, skills, and quick thinking can make all the difference. In a future session, we'll explore treatment strategies in more detail, including the use of IV fluids, whole blood, and medications such as TXA. Thank you for joining the 10-Minute Medic. Our next podcast will take a look at cardiac changes in the hypothermic patient. Winter will be here before you know it, and this will be an important episode, one that you will not want to miss. Thanks again.